So the new working week today began with good news. Only one new coronavirus infection case and life in Bangkok and many other major cities returned to some semblance of normality this morning. Traffic jams were back
คม
on Bangkok streets
2563
again,
ในฐานะโฆษก
right?
ของ
And what
สบค
Kunata, what
นะ
is
ครับ
interesting is that the chaotic scenes we saw at many supermarkets and convenience stores on Sunday, where people trying to go over each other to have their hands on earboxes, continue to be a major topic of debate today. Even Prime Minister Prayut himself had something to say about this.
That's right. Especially, he would like to tell all of us to keep social distancing. That's still very important messages. Even though easing of restriction, easing of lockdown measures in Thailand has already happened. For 2 days, that Kun Thepchai has already mentioned, it started on Sunday. But the chaotic scene or the busy business as usual and traffic on the roads perhaps remind everyone that we are not back to normal yet, but we still have to be very cautious at this point, even though it can be cause of celebration at some point, Kun Thepchai, with just one more infection today. But we still have to remain cautious.
Yeah, definitely. I mean, trying not to be complacent is the catchphrase that we have to always bear in mind. Lower or, zero infection case doesn't mean that the things are back to normal, meaning that we have turned the corner. I think this is something that medical authorities have been warning us that, all right, good news, we welcome it, but try not to be too complacent or to start ignoring all these essential social distancing directives.
And with the case of 40 cases of testing positive from Yala province is still very controversial because from the first 2 rounds of checking, it was conflicting in terms of result. The first round, the 40 cases from Yala province were tested with positive result. And then the second round, all 40s are negative results. So right now, it's still on the checking in the lab, and we do not know the case yet, whether they are all positive or negative. They are the cases from active case finding or ACF test by a new laboratory in Yala province. And then the second result, the second round, tested as negative. And right now, the new specimens were collected from all 40 subjects and sent to Disease Control Department in Bangkok for final analysis. And perhaps later today in our program, Kun Thepchai, probably we can have clearer picture from Dr. Thanarak Phalitpat, who will be joining us later.
I'm sure that people have a lot of questions to the discrepancy between the two tests, right? As Kunata mentioned, the first test for 40 people came back positive, but the second one came back negative. So the result of the third round of tests is still pending. And of course, the question is why things could have gone wrong with so many people, 40 people. I mean, of course, it's nothing out of the ordinary for diagnosis to be wrong in testing for few patients, but 40 people being tested, and the second round of the testing disputed the result of the first round. So let's see what will happen after the third round of checking. But Kunata, as we mentioned earlier, that Sunday we just went by, which was the first day of the relaxation of the stringent shutdown measures, saw quite chaotic scenes at many supermarkets and convenience stores. I could not remember people fighting each other to try to lay their hands on beer boxes and other alcoholic drinks. I mean, of course, understandable. The people were so pent up after a month of lockdown, so they went out to try to enjoy their favorite drinks. But of course, those scenes that went viral on the social media obviously infuriated the Prime Minister Prayut, who today said some order need to be maintained at these stores. And he issued a threat that if the same thing happened, if there is a recurrence of this kind of chaotic scenes or chaotic situations at these places, they will be closed definitely. So it's ultimatum from the Prime Minister that he will not tolerate this kind of situation.
That's right. That's why we all still have to remain very cautious, as the Prime Minister told all the shopkeepers and consumers that they have to maintain social distancing. That is very crucial at this stage. And talking about social distancing, Kun Thepchai, the scene at the Bangkok Transit System electric SkyTrain in Bangkok this morning in particular must be quite alarming, probably for Prime Minister Prayut Chan-o-cha as well, because it seemed improbable to follow social distancing during this morning with technical errors happen at Bangkok Transit SkyTrain system. Thousands of people heading off to work, but they ended stranded at BTS station after services were hit by a technical error. And there was a post via Twitter at about 6 a.m. from BTS SkyTrain Authority, which states that there has been a technical error on the rail near National Stadium and Siam stations. The delay will take roughly about 10 minutes, and we are sorry for any inconvenience. So that must be really difficult morning for passengers on the SkyTrain, Kun Thepchai. But clearly, many people have worn facial masks, which become very essential nowadays when we have to commute or using public transport.
Certainly, this kind of scenes, people cramming in closed space like this, certainly is not something that authorities want to see, because this is certainly, a violation of all social distancing rules. So the atmosphere at the moment there is quite different from what happened this morning, Kunata,
Yes.
because of the technical error that happened. So the service was suspended or delayed. So that's why we saw huge clouds of stranded passengers jamming together, obviously in violation of all the social distancing directives. So it's a pity that after all the cooperation that we have been receiving from members of the public over the past 1 month, so we had to come to this kind of situation unexpectedly, of course, and of course the people were not to blame, but it's the technical error. What could we do?